Well, welcome everyone. My name is Carrie Baldwin-Sayer and I use she, her pronouns. I'm the Associate Dean of Students for Health and Wellbeing. I might have met some of you yesterday at the Student Support Panel, so welcome back. This is our Health and Counseling Center panel and question and answer session. I'm joined by my colleagues and I'm going to allow them to introduce themselves. Why don't we start with Dr. Johanna Workman?
Hi, everyone. We're so happy to be here with you today. My name is Dr. Johanna Workman. I am a licensed clinical psychologist, and I am the Director of Counseling Services here in the HCC, the Health and Counseling Center. And next, it will be Dee Seawright.
Hi, everybody. My name is Dee Seawright, and I use they, them pronouns. And I'm the clinical case manager here at the Health and Counseling Center. So I'll pass it to Anne.
Hi, everyone. I am also very excited to be here. This is one of my favorite times of the year, welcoming new students. I'm Anne Kimberly. I use she, her pronouns. I'm a certified family nurse practitioner, and I've been here a pretty long time, and I love my job.
Thank you so much, everyone. I wanted to start by sharing with you all the format for today's session. We're going to start with a brief overview from our panelists about the services provided at the Health and Counseling Center. You'll hear HCC a lot. That's our acronym for Health and Counseling Center. And that overview might end up answering some of your questions. After that overview is done, we'll go through some of the questions that were submitted in advance by parents. And then after that, if we have time, go ahead and put questions in the chat and we'll try to spend as much time answering those. If we don't get to your questions, if there's not time, we're going to aim to wrap up by about 11:55. But if we can't get to all of those, you can email health-services@reed.edu and someone will get back to you. I'll repeat that email address at the end and I'll put it in the chat at the end as well. But yes, if you wouldn't mind holding your questions until we go through the overview and the pre-submitted questions, that would be great because some of your questions might get answered in advance. So thank you so much. And why don't we go ahead and get started with an overview of our counseling services.
All right, I'm going to do my very best to attempt to screen share. And it's going to hit the. Does that show up properly? Okay, well, welcome to the Health and Counseling Center. If you all haven't been here before, we're a building a little bit separate from the rest of the campus, but we're still on the college campus. And this is our building, the Health and Counseling Center. I have a little bit of a tickle in my throat. Hold on just a sec. Dee, I have a bit of a tickle in my throat. I'm going to have you take this part over, okay?
Yeah, sounds good. So these first couple slides is just a brief overview of the staff that we have in on our counseling team. So this first slide is our 3 current counselors here at the HCC. They are all really, really wonderful. Of course, I'm biased, but really skilled therapists and counselors. And then the following slide is just the rest of our team. So there's me, the clinical case manager, Johanna, our director. And then we also have Max, who is our administrative coordinator and the person at the front desk who's often the first person that students talk with or see when they come in the building. And he's a very knowledgeable and welcoming and wonderful human to have in that position. A little bit about services that we have in the counseling services specifically. So we have brief solution focused therapy provided by our 3 counselors. We also have a number of group workshops and therapy groups. We have some addiction, alcohol, and drug support available, as well as eating disorder support. We offer outreach and training across campus on different topics. And then case management services. I'm always forgetting about myself. So my kind of primary role is assisting students in connecting with both on-campus and off-campus services, mostly related to their mental health and medical care. But of course, there are so many intersections within that, and so many things that impact mental health and physical health. So those are some of the things that we have. I'm looking at this list now. I forgot to mention that our gender affirming care, which Anne, I'm sure will speak more about as well. And I think that's it. Johanna, did I leave anything out? We might have lost Johanna for a second.
Sorry, I'm sorry.
That's
This is
okay.
like at the absolute. Can you see me all?
Right. Yes.
Okay. It's just the worst time. I just got a little bit of a tickle in my throat. Sorry, and I missed a little bit back. I'm going to go back. Did we talk about all the wonderful folks we have working in our center?
Mm-hmm.
You did? Okay.
Yeah.
Wonderful. And you talked about all the wonderful services we offer?
Yeah.
Okay. I think we are done. Thank you. I'm going to stop sharing.
Thank you so much. We don't have a slide set, but I'm going to ask Anne to share with us the basics of the medical services that we provide. And I'm also putting in the chat our website so that folks can go to that, and all of the information about our services, both medical, counseling, and otherwise, are available at this website as well.
So I feel a little bit ashamed to not have a slide set, but next year, you're welcome to come back and watch when I do it next year. So let me just tell you a little bit about the overview of the medical services. So I'm a full-time nurse practitioner here. We have Elizabeth, who's a part-time, also family nurse practitioner. Our medical director is Timmy Roshan, and she's also got her doctorate in nursing. We have one RN named Katie, and we have two medical assistants, Matt and Julie. So that rounds out our, oh my goodness, Rachel. Sorry, Rachel is a naturopath by training and specializes in mental health prescriptions, and also can do all the primary care stuff too. So kind of in overview, we are only for students. It doesn't cost any money for students to come and see us, which is really great. We do kind of that basic primary care stuff. We can do a physical for study abroad. We can look at a twisted ankle, look at a sore throat. We have some basic testing supplies to rule out strep throat and mono. We see a lot of students for concussions. You'd be surprised. You know, I woke up and hit my head on the windowsill to a rugby injury. We also have phlebotomy services. So if Elizabeth, Rachel, or I order some lab tests, we can do that here. If your student has a provider at home that they're going to stick with for a particular problem, say a thyroid problem, and they need to get their TSH level done every once in a while, we can collaborate with them, and they send us an order, and then the student can come and use us as a phlebotomy service, and their provider at home can still manage. We have a limited pharmacy, so maybe 6 or 7 antibiotics, some steroids, some inhalers for asthma exacerbations. We do contraceptive services and sexual health, so we do carry a birth control pill and kind of write for anything students are looking for. We can place Nexplanon, which is a long-acting reversible contraceptive. We have vaccinations, and we have expanded our vaccinations that are available on campus to include the meningococcal options and varicella, in case your student hasn't gotten those and wants to. We do a lot of Gardasil, the HPV vaccination, maybe catching up on that last dose. and tetanus every 10 years. Usually the seniors need that. We can do minor procedures like suturing, taking care of that unfortunate abscess that can happen. We've got medical supplies, and we can do referrals to specialists such as physical therapy, chiropractic, whatever your student is looking for. Again, doesn't cost money to come and see us, but some of the things like a strep throat test, there's a small fee, like $10. And then other things that cost money are billed through your student's insurance. Okay, very long-winded, lots of information. Good luck.
No, not at all. In fact, I think you actually answered some of the pre-submitted questions with that talk. So thank you so much. But now what I'd like to do is start with some of the questions that folks submitted in advance. Apologies if some of these might be a little bit repetitive with what you already presented, but it probably never hurts for folks to hear things again. And then after we go through those pre-submitted questions, feel free, if any of your questions weren't answered, to type something into the chat. If we have time, we will get to those. So, Anne, since you were talking about a few of these things, one of the questions that just came in this morning was, can you assist students with finding clinics and pharmacies that can take their out-of-state insurance, and also with getting prescriptions filled?
Yeah, absolutely. So I just also want to clarify that we can see any student. So you can have an HMO like Kaiser, or your student could be on the Oregon Health Plan, and we can see them. There are limitations, however, for anything that costs money. HMOs, and including Oregon Health Plan, don't let us do everything we would like to do, but we can assist your student in figuring out how to make it work. So yeah, if your student, what I would ask is, because every insurance company has 392 million plans under their own umbrella, and they're all different, we can't possibly know your individual student's plans details. So I ask you please to take half an hour, get on the website for your insurance with your student, and talk through the basics. Explain what a copay is. Explain what a deductible is, just so they have an idea. We can see them, but there are some things that we may not be able to help them with right here, and have it be the most economical for you. But we'll help figure all of that out. We've got 2 local pharmacies, super close. Most students use either the Walgreens on Cesar Chavez and Holgate, or the pharmacy in the Safeway on Southeast Woodstock. We can help them sort that out, but please take that 30 minutes, give them a run through on it. I'm confused about insurance and I'm in the business. So it's really hard. And it's kind of the beginning of helping them launch to be successful adults, is handing this over to them. So freshmen, we help a lot, right? Seniors, we're hoping they're kind of getting it, but of course we'll help.
Thank you so much, Anne. And that actually, I'm going to try to bundle some other questions that are kind of similar to that. If a student is already on a medication, say a medication for depression and anxiety or something to that effect, is Dr. Rachel able to meet with students, and or would someone need to find a provider off campus for filling a prescription like that?
Yeah, great question. A well-utilized service. So if your student is really stable on, let's say, an antidepressant and an anxiety medicine, and has a provider at home who's willing to continue to provide care, stick with it. Have your provider call, or have your student help them call a local pharmacy and get a prescription transferred, okay? If it's not going to work for your home provider to continue services, Dr. Rachel, myself, and Elizabeth are capable and experienced in providing antidepressants and anti-anxiety medications. Situations that are a little more complicated would go to Rachel, because that's all she does. That's her specialty. So that's definitely an option. But again, those students who are really stable, if you can, stick with your home provider. It's great to not have to explain everything all over again.
Thank you for that. For Johanna and Dee, can you tell us a little bit more about gender counseling services that Reed has to offer? And is gender affirming therapy something that could be done at Reed?
Yeah, I can take that. So in terms of our counseling services, our counselors are all trained in providing gender identity counseling and assisting students with sorting all of that out. Our medical team also provides hormone therapy services, which we're really lucky to have here. And I'm very connected to a lot of the transgender healthcare clinics in the area. So if students need any sort of off-campus medical care, I can always assist in connecting them with that.
Wonderful, thank you. Anne, did you want to add anything?
Sure, yeah, we started maybe 2 or 3 years ago providing medications for transition, and we are also excited to be able to do this, to help students achieve what they want to achieve with them. And again, like Dee, I also have close connections with some of the local clinics that do the same thing. Some students choose to not do this here. That's fine. We've got great people locally. If they already have a provider at home and that provider is willing to continue, again, we can collaborate. We can help with blood draws as needed, but we are ready and willing to help with that process of transition from the medical side.
Thank you both so much. I think this one is for Anne. Anne, can we provide allergy shots if the student already has their reagents?
Yes, we would like to get a release of information, an ROI, signed from the provider at home, kind of giving what the plan is. And if that provider is still willing to write for the prescription and have it sent to a local pharmacy where the student can pick it up and bring it into us, we're happy to give them the shot and watch them for a little bit. But we do want that to be for students who are kind of already established.
Wonderful, thank you so much. Dr. Workman and Dee, will long-term counseling be available to students?
For the most part, our counseling services department is staffed only to provide short-term solution-focused therapy. For the demand is very high relative to the staffing needs, particularly coming back from a pandemic. So our goal is to be able to see all the students as quickly as possible who need treatment, but we have limitations on how much treatment we can provide here. For students who have longer term needs or who need more intensive services, our clinical case manager, Dee Seawright, will assist in providing referrals to clinicians in the community who could provide that more long-term or intensive level of care.
Thank you for that. And along the lines of counseling in general, will there be in-person counseling available this year? Because that was something we weren't able to do very frequently last year during COVID.
It's a very good question. And the response is that because we are still in a pandemic, we highly encourage students to have sessions through the telemental health platform. And it's because of the nature of therapy. It's a little bit different than other services. It's closed door. It takes usually about an hour to provide. And then there's a masking requirement, and it's hard for our clinicians to read expressions when you have a mask on. So for those reasons, and also the students have indicated that they like the convenience of telemental health because they may be going from class to class. We're on the opposite side of the college here, and they can, with telemental health, they can squeeze in a session in between classes versus walking down and walking back. However, with that said, yes, if a student presents with a need for an in-person session, we will make that accommodation and we will do everything possible to make that session safe. So socially distanced in the largest room we have possible, ventilated with windows, and perhaps a briefer session to prevent any, even though we're all vaccinated, to prevent any possible transmission and to keep everybody safe.
Great, thank you so much. Let's see. Our next question, I think we answered that one. Anne, do our students have access to a dietitian or nutritionist?
We do not have either of those specialties on staff, but I do certainly know people locally in the neighborhood even who are specialists in these areas. So a lot of dietitians and nutritionists don't take insurance, so it is out of pocket for the student. Some of them do take insurance, but we are happy to provide a list of names. You know, I do basic kind of discussions with students around healthy lifestyle choices. As is often the case with this age group, the reminder that, you know, good food and good sleep really goes a long way to being more successful in life. And as a parent of a 17-year-old, I can tell you that he doesn't listen to me at all. But we do talk about that almost in every visit, but happy to help refer.
Thank you. Johanna or Dee, what services do you offer for students with anxiety? Are there any, and this is part of the same question, are there any animals on campus that students can hang out with or pet or walk?
Can answer that. So yeah, as far as services for students with anxiety, the services that I mentioned are all available. So, you know, the brief individual counseling, we have group support, medication support, we have a 24-hour hotline for any crises that come up and daily walk-in sessions available. We don't have a therapy pet in the HCC. I think that's a really cool idea, but we don't currently have one. But if, you know, I don't know if folks have been to campus yet, but we have the beautiful canyon on campus, which a lot of students report they find to be really calming and therapeutic, going for a walk in the trees, seeing beavers, seeing the wildlife down there. So that is a readily accessible resource on campus.
And I think also one of the staff members, Will, in the sports center, he's got a retriever.
Golden retriever, yeah.
Golden is red. Anyway, the dog's name is Ginger, and that dog, I know that dog visits with a lot of students. So yeah.
Yes, and Will does make Ginger available for anyone who would like to take Ginger for a walk or just wants to hang out with Ginger. Ginger hangs out in the outdoor center area of our sports center, so she's always there for folks. Let's see, have we answered this question? Well, I think we took care of the insurance question. Someone asked about having a particular kind of insurance and wondering if we were in network. And since students don't need to have insurance to come to the HCC, we wouldn't bill their insurance for a visit. We might bill their insurance for services that like laboratory services, or we might put something on a student account and then give the student the paperwork for getting reimbursement. Is that accurate, Anne?
Absolutely. And when we can, we even like give them an envelope and mail it for them. But we are, again, trying to help them learn how to do that process for themselves. If your student has purchased the Pacific Source plan that we brokers for students at a pretty good price, it's a really good insurance. I'm not sure this year, but generally I'd say it's more than half of the students have that insurance. So we do know that insurance pretty well. It changes just a little bit every year. So I can't tell you the prices because that's of course what mostly changes. But it's a very good insurance. If you go onto the Pacific Source website, you'll be able to get in the student will be able to find, and they were calling it last year a temporary card. I'm not sure why, since it's the only card they're going to get, but have your student go online and print that up, and that's their card. So when they come into us to do anything that costs money, we will look in the student health portal. If your student has not uploaded their insurance information into the portal, when we look at insurance, it'll say none. So we struggle to help students. So please ask your students to do that and have them, again, look at their website. As far as Kaiser, I recommend, there's actually a number that there's a helpline that can assist your student to get a guest membership. And I can put that number in the chat. I recommend, if you're from out of state, that your student get a guest membership. Just makes it a lot easier, but they certainly can come into us. And so many of the things, like if they have a small infection, I probably have antibiotics for $15. And if they would rather me sell them antibiotics for $15, we'll put it on the tuition account and they don't have to go to Kaiser to be seen or to get their prescriptions. If your student is on a medication that is a long-term medication and you have the opportunity to use the mail order pharmacy through your insurance, have them do that to the student's mail stop. The nearest Kaiser is probably 5-6 miles away. They're on both sides of campus, so it's accessible by public transportation.
Well, and I want to reiterate a really great point that you made, Anne, in that even if your student does have insurance, the services at the HCC are available to them at no cost. There are a few things, as we said, that have costs, like laboratory testing, prescriptions, et cetera. But the visit itself, to be assessed for whatever's going on with them, is at no cost to them. So it's a great service for students to be able to have, even if they do have insurance, especially if they live on campus. It's a lot, oftentimes more convenient. I think we are done with the pre-submitted questions. So let's move to the chat. I'm going to move back up because, a lot of questions have come in. That's okay. I'm going to let's see. First question, we talked about ongoing counseling already, but let's talk about that real quick. Again, I just want to, Dee, can you outline if we believe a student needs services that we're unable to provide at the HCC, what the process would be for that?
Yeah, if there is a student who basically wants longer term services or more intensive services than what we can offer here at Reed, we have connections with a lot of providers in the community. I keep a long list and have frequent communication with a lot of providers. So I can assist students in connecting with those providers. And yeah, from the spectrum of support from, just giving them a list and letting them pick themselves to if they need assistance with learning how to make those phone calls or send those emails, I can sit down with them and help them learn those skills. So I'm always happy to provide that support.
Thank you so much for reiterating that. I appreciate it. It looks like quite a few of these questions have already been answered. Let's see. If there's something individual, if there's something that you need specifically sent to you, could I request that folks send an email to health-services@reed.edu, health-services@reed.edu. Thank you. And let's see, can you also prescribe ADHD meds if they are already established? Anne is nodding her head.
So again, that is something that Rachel does. We do not provide the assessment aspect for ADHD care. I believe our counseling team knows resources in the community if a student needs to have that completed, and that would go through your insurance. If it is decided that there is a true diagnosis, then a visit with Rachel would be the next step if you're not going to go through a home provider.
Thank you for that. You answered 2 questions simultaneously, so thanks. Let's see. Aside from one-on-one services, what is Reed writ large doing to address the mass anxiety isolation this class has experienced in 2021? Ooh, big question. Well, we can talk about the HCC services, and this might actually be a nice time to talk about Together All. I don't think we've mentioned this great new service Together All. Does anyone want to chat about that?
Sure. So one of the things we're doing to address the mass anxiety about the social isolation is we realize the students they're coming back. They've been delayed in a sense from having social interactions during the pandemic, and they're at a developmental age where social interactions are highly important. So this semester, we're going to be creating a number of group therapy formats, workshops. They're likely going to be on Zoom just to keep everyone safe. But the function is to connect socially and for students to provide mutual support. We also have a project called Together All. We acquired it last semester, and it is a social media platform for students who can connect across campuses. That all they need to do is use their Reed ID and have support. It's monitored by licensed mental health clinicians. So if students are using this platform and indicate any risk factors or need more intensive services, they're called wall guides. They're licensed clinicians. They'll step in and connect individually with a student. And if students are experiencing a psychological crisis that needs immediate intervention, in the moment intervention, they'll connect the student to our 24/7 after hours platform so that they can get that crisis intervention. It's a cool product. If I can I might be able to do a little bit of a screen share to show you kind of what it looks like. Let's see. Nope. Sorry about that. I'm not great at this. Basically, it's a cool part. You can use it on your phone. They have it so you can use it on a computer, and you can also use it on your phone. It looks kind of fun. It looks like Facebook or Instagram. And we're going to be doing a big advertising blast in the next week or so. It will be on the Reed Instagram and Twitter feeds. But it's a way that students can have really good support and connections. And it's also for the students who may not necessarily want therapy, and they may not feel like they're not in crisis enough to call a 24-hour hotline, but they want to get support. So we'll be able to put that out. Together, it's called Together All. And if I had the thing up, maybe I can figure this out.
Well, and folks can go to it too. I don't know if they can dive into it without actually having an account, but togetherall.com.
I think I just figured this out. Okay. Okay, let's see. And I'll do the present button again. They didn't have this when I was going to school. Let's see. Okay, can you see that?
Yes.
You can, and I'll just show you I'll take you to the website. There's a demo. I'll take you to the website, and this is the project right here. Oh, it's a little button here. I think I can press this. Can you hear this?
A safe place to talk, share, and support others like you, moderated by professionals 24/7. Everybody is safe. We don't use real names, and we take your anonymity seriously. Once in, you can use a range of tools and services. Connect with others who are experiencing similar thoughts and feelings. Express yourself creatively by posting a break. Keep track of thoughts and feelings in your very own journal. Identify and work towards your goals. Understand what you're experiencing and track your progress. Take part in an online course where you can chat with others and share tips on what's working. And when you need a bit more support, our clinically managed and registered wall guides are just a click away. So join today to get support, take control, and feel better.
Okay, thank you for that.
Thanks for sharing that. That's great. All right, next question. Oh, about COVID. I'll take that. Can you please explain COVID precautions on campus and how students will be notified of exposures and how do students get tested? All right. Students will be notified of an exposure in the same way that we did last year through our contact tracing process. So it's all quite confidential, but it does mean that a student who has had a positive COVID diagnosis, we would talk through with them about the contacts they had had during their contagious period. And then the folks that were known to have been exposed would be contacted by a member of our HCC medical team and would be talked through the next steps about getting tested at the HCC, whether or not quarantine is needed, et cetera, the best next steps. But testing, if students have a known exposure or symptoms of COVID, we can do all of that testing at the HCC. We're also doing surveillance testing on a weekly basis of any folks who are unvaccinated. So let's see, next question. Will students be given health insurance cards for the insurance?
So yeah, that
Thanks,
was
Ann.
the one, sorry, go on. So for the Reed College supported or brokered plan Pacific Source, you need to go online, print up that quote temporary card. That's your permanent card. Yeah.
Thank you for that. Dentistry services. I don't know if you want to take this, Anne, but I know we don't provide dentistry services on campus, but we can certainly make referrals.
Yeah.
And is there anything else you want to?
Yeah, so if a student feels like they might have an infection in their mouth, I can certainly look at that and I can prescribe antibiotics if necessary, but we don't have a dentist. There's lots of them around. Most health insurances don't include dental. So some families will have their own private dental insurance. It's dentist stuff is tricky and expensive and it's frustrating. I would say, if your family has the means, think about just $50 a month in a little fund. That's what I've done when I haven't had insurance for my family. Most of the time, it's not needed. There are some services under the Pacific Source plan for the younger students, and I don't have it right at the tip of my tongue, but I think if they're 18 or 19, there's some very limited preventative stuff. Do you know?
I'm pretty sure it's 18 and under.
Okay.
So for 17 and 18-year-old students.
Yeah. Darn it. I will see. I'm going to make a note and I will get that information to Carrie. So same thing with vision, with the Pacific Source insurance for the youngsters, the younger students. There are some very limited services that are covered.
Great, thank you so much. I think we answered the question about Kaiser already. And then you said that if prescriptions needed to be mailed to a student, they should be mailed care of their mail stop number.
Yes.
Which each student has individually, right? Okay.
And just to add on a little bit, if your student has, what I suggest to students is that they call their insurance and ask to have their insurance information and their explanation of benefits, etc., sent to their mail stop. This is again part of becoming a competent adult that we all wish we didn't have to do, but having them get their information to their mail stop is better than having it go home. And it also helps them understand the confidentiality aspect that sometimes this is hard for parents to hear, but there are rules, there are HIPAA rules that protect your students' confidentiality, even though they may be under your plan. It means you don't get to know everything anymore if they're 18, I believe. So yeah, it's just a good step. Get everything sent to the mail stop.
Great, thank you so much. How are we doing on time? We've got good. We're doing okay. Oh, here's a good question. I'm going to add on to it a little bit too. If someone has a provider outside Reed and that provider wants the student to have a blood draw, first, is that something that a student could, if they had an order from that doctor, could they have that done at Reed? And then number two, is there a cost for that?
At this time, we don't charge for that. Yep, we just have to get that order from the student. If we have that, we don't even need to have a visit with the student because we are not managing it. We are just a phlebotomy stop where we take their blood and then that result goes to their provider and their provider manages it. If they decide that they want us to be managing things, then it's a little bit different service.
Great, thank you. There was a question about someone who is who's concerned about a Wi-Fi router close to their student in their dorm. I would recommend contacting our residential life office about that, and they can be reached at reslife@reed.edu, which is res-life@reed.edu. Someone asked about the name of the Reed insurance plan. It's Pacific Source, and you can go to Pacific Source website and go specifically to the student health information page. And then on that page, it'll have all the different schools, and you can click on Reed as one of the schools to see our specific health plan for Reed students.
I just put the link in the chat for that.
Thank you. Appreciate it. Let's see, following up on the blood draw question, if there are specialized tests needed, can you send it to any lab that our insurance covers?
So we have LabCorp, that is the lab that is covered by Pacific Source. So they come and pick up from us every day after work. If a student's insurance requires that it be Quest or something else, we could do the draw, but we can't get it to them. So generally we don't do the draw for that. And we would help the student find the closest Quest lab or whatever type it is. It's a little frustrating, but it's a system a little bit beyond our control.
I appreciate that, thank you. What are the hours of the HCC and how does my child get healthcare after hours?
So the hours are Monday through Friday, 9 to 5, with the closure for staff lunch and decompression from 12 to 1. We do have an RN triage phone number, which I'm frantically looking for in my room. I'll put it in the chat. And that is a service that we subcontract with. They are awesome. So if your student has something happen at 3 in the morning or 5 minutes after 5, they call that service and they explain the situation and the nurse helps them triage what they need to do. I put some of this information in the chat as well. One of the things that's really hard is the insurance aspect when it comes to like urgent cares. So if you have the time to do this for your student now, that would be great. But taking a look at your health insurance, seeing which urgent cares locally, you can look by zip code, are covered, because every once in a while a student will get a big bill from an urgent care because they didn't go to one that was in their network. But a lot of students use Zoom Care. They're like all over the place. They're like kind of like Starbucks. They're all over the place. We generally, if they come in to see us afterwards for follow-up, we will call for records so we know what was done. Did I answer that question? Sorry, I get carried away.
I think so. Yeah.
And I also just
So
put that number for them, the 24-hour mental health crisis line in the chat too.
Okay, and I'll look for the.
I already put the nurse line in there, Anne.
Oh, you did? Thank you.
thank you. So we have both after hours counseling and after hours medical advice line. Excellent. Thank you. If someone has HIPAA and healthcare power of attorney, should they be submitted to be on file at the HCC? I'm wondering if that is like sort of an ROI situation to allow the parent to talk with a provider about the healthcare situation with their student. I'm guessing that's what that is. And that if that's on file at the HCC, then that's the student giving permission for the medical or counseling provider to talk with the parent, I assume. Does that sound about right?
I can address that from the medical point of view. One thing that we are really clear on with students is that what happens in the health center stays between the provider and them. I'm not speaking about people who are under 18, a little bit different, and maybe Dee can speak to that, or Johanna later. Nothing that happens here, except for rare circumstances, goes to the academic side of, I call it a firewall. There's a huge firewall between the HCC and the academic side, and between parents. Obviously, if there's a life and death issue, that's a different story. But every time the student comes in here, they have the opportunity to change those ROIs. I personally am not a big fan of kind of a blanket ROI. I think it can lead to the student having some concerns that we aren't confidential with them. And frankly, if I have a student who's coming in to do something that they haven't talked to their parent about, like an STD test or something, I want them to feel really, really comfortable that nobody's calling parents. And we don't do that. It's a hard one to swallow. Again, as a parent of a 17-year-old, I totally get it. But I want to assure you that if there's something that's, life or limb, it's a little different. I don't know. Do you guys have anything to add to that?
Our confidentiality laws on the counseling side are similar to yours, that we're pretty strict. We want our students to have informed consent and that their treatment is kept confidential and private. If there's a situation where it's necessarily or helpful for us to talk to parents, then we will also get a release of information form, and it will be a limited release of information. We'll be limited in what we can talk about, only what's necessary, and there will be a time duration on it. It won't be a blanket release to speak for the next 4 years, and that also can be difficult for parents to swallow. In the state of Oregon, individuals can be as young as 14 and consent into their own therapy without any permission from parents. So,
thank you, everyone. I am putting in the chat the link to our sports center, because the next question was, what are the hours of the gym? So I put that link in there, and yes, it is open 7 days a week. The hours aren't the same every day, but students have access to that every day. Let me go back up to the top. Apologies. So I get all the questions. Will Reed have COVID vaccine boosters? Most likely. It's and I don't know if you have anything to add. We're still waiting for guidance on this. But we do have Pfizer and Moderna vaccines on campus presently. And right now, the earliest that boosters would be given for immunocompromised people, healthcare workers, and the elderly are, I think, probably sometime in September or October, because that's when the first vaccine, about 8 months after the first vaccinations were given. So we'll have to see what supply is like, among other things. And anything to add?
Yeah, I think, we're going to do the best we can to follow all the guidelines. And I'm telling you that my boss is on it. She knows this stuff inside and out. I learn something from her every day when it comes to COVID and vaccinations. And so I want to assure you that whatever is approved and what is recommended, we will be providing. Again, based on supply. So for example, last year we were ready. We were so ready, and we waited and vaccines were available just as the students left campus. So, some things again are out of our control. I anticipate that because the vials are multi-dose vials and have a very limited shelf life once they've been mixed or opened, that we will try to group doses. So for example, we may put out some type of notice. Hey, anybody who has an immunocompromised condition or concern, we are planning to do boosters on such and such days. Please call and schedule. And we will blast that out. I mean, a student has to be just walking around with their music on and never taking it off to miss this kind of stuff. But I do encourage you parents to remind them they are overwhelmed with new information, and they hear about, the typical statement is you hear about 30% of what you're told. So please do remind them that we will be providing on those boosters as soon as we can. And yes, we do offer regular old flu shots every year. We do our best to really broadcast that as well. And that's usually, I want to say, October.
Thank you so much. I want to be cognizant of our time. It is 5 minutes to noon. So I think we can, we might be able to take 1 or 2 more questions. If we did not get to your question, and I'm so sorry that we weren't able to get to everyone, I am putting in the chat the email for any questions that didn't get addressed. Please feel free to email us and we'll get back to you as soon as we can. Things are a little busy this week with orientation, so please be patient with us. But please do send us an email if we didn't get to your question. Going in line here, someone asks about group counseling or support groups for neurodiverse students. Is that something that exists at Reed?
We don't currently have that specific group, but we may. I also know a number of providers in the community who offer support groups specifically for neurodiverse folks that I highly recommend. So I can always get students in touch with those providers too.
Thank you. Let's see. Some of these questions I think have already been answered. And if it's, let's see, if your student is hesitant about seeking mental health services, but you have concerns, what's the best way to communicate that with you?
I think the care team would probably be the best route for that. So we have a wonderful care team here at Reed that's comprised of folks from multiple departments in student life. And there is a care referral form. Is that right, Carrie?
Mm-hmm.
I don't know if you have the link for that.
But I'm going to try to find it.
Yeah. Parents, students, faculty, anybody concerned about a student can always submit one of those forms. And then Britt Hoover, who is the lead of that team, navigates those and connects those students with appropriate support services.
I just put the link in the chat. Thank you for that. Let's see, what is our time? I think we have to wrap up. Well, I want to thank everyone so much and thank our panelists for being here and our parents for asking such great questions and listening. And please do, if there's any question we didn't get to, please do write to us at health-services@reed.edu. read.edu, and we'll get back to you as soon as we can. So thank you so much, everyone, and welcome to Read.